All right, so you're looking to help your patients have a truly happy Valentine's Day and a fulfilling intimate life beyond. We've got a deep dive today into the latest in sexual wellness. It brings together that medical excellence you strive for with a holistic approach that'll really benefit your patients.
It's fascinating how we can combine cutting-edge treatments with lifestyle changes to create a powerful wellness blueprint for your practice.
I like that, a wellness blueprint. Let's set the scene. Valentine's Day, it's supposed to be all about passion and connection, but modern life can throw up some roadblocks.
Absolutely. We're talking stress, environmental toxins, even too much screen time. All those things impact hormones and can sabotage intimacy. But the good news is there are solutions.
Okay, let's unpack this a bit. First up, the microplastic problem. We all know they're everywhere, but how are they impacting our patients' sex lives specifically?
Well, we're exposed to these tiny plastic particles through food, water, even the air we breathe. And the scary part is they can actually mimic hormones in the body and disrupt that delicate balance of estrogen and testosterone. This can lead to low libido, erectile dysfunction, all sorts of issues.
So it's not just about saving the planet, it's about saving our patients' sex lives too. What are some practical tips you can share to help minimize exposure?
Filtering your water is a great first step. Also, be mindful of seafood choices. Shellfish in particular tend to accumulate higher levels of microplastics. And of course, reducing single-use plastics whenever possible.
Now let's talk about stress. We all know it's a passion killer, but what's the science behind it?
When we're stressed, our bodies pump out cortisol, the fight or flight hormone. And while cortisol is essential for survival in those short bursts, chronically high levels actually suppress the production of sex hormones like testosterone. Think of it as your body prioritizing survival over, well, romance.
So if your patient is juggling a demanding job, family responsibilities, financial worries, their libido might be taking a back seat to their stress response. It's like their body's saying, now is not the time for romance. What can we do about it?
Well, first we need to identify and address the sources of stress. Easier said than done, right? But simple things like getting enough sleep, regular exercise, and mindfulness practices like meditation can go a long way in managing those cortisol
All
levels.
right, that's the holistic side of things. Now let's get into some specific treatments. For men with low testosterone, testosterone replacement therapy, or TRT, can be a game changer, right?
Absolutely. And it's not just about boosting libido. TRT can help restore overall vitality and well-being, improving mood, energy levels, even muscle mass. But it's crucial to remember that TRT is not a one-size-fits-all solution.
So no magic bullet.
Right. Personalized care and monitoring are essential. We need to carefully assess each patient's individual needs and adjust dosages accordingly. And for men who want to preserve their fertility, we have other options like enclomiphene.
This is one I'm less familiar with. How does that work?
Enclomiphene is a selective estrogen receptor modulator, or SERM. It works by blocking estrogen in the pituitary gland, which tricks the body into thinking testosterone levels are low. This, in turn, signals the body to produce more testosterone naturally.
So it's like a natural testosterone booster. What are the advantages of that over TRT?
Well, for one, it preserves sperm production, which is a major concern for men who are considering fatherhood. It's also generally well tolerated and has a lower risk of side effects compared to TRT.
Okay, that's good to know. Now let's move on to the medications many of us are familiar with, PDE5 inhibitors. These have been the go-to for erectile dysfunction for years, but can you remind us how they work exactly?
Sure. PDE5 inhibitors like Viagra and Cialis work by targeting an enzyme called phosphodiesterase type 5, or PDE5. This enzyme is responsible for breaking down a substance called cyclic guanosine monophosphate, or CGMP, which is crucial for relaxing smooth muscle in the penis and allowing blood flow for an erection.
So by inhibiting PDE5, these medications essentially allow CGMP to hang around longer, leading to stronger and more sustainable erections. But they don't actually increase desire, do they?
But that's right, sexual stimulation is still necessary. They simply enhance the physiological response.
Got it. Now, for those who haven't had success with PDE5 inhibitors or who are looking for something different, we have other options like Trimix and PT141.
Yes. Trimix is an injectable medication that's a combination of three drugs that work together to increase blood flow to the penis. It's a bit more invasive, but it can be very effective for men who don't respond to oral medications.
And PT141, this one always seems to pique people's interest. Why is that?
Well, for starters, it was discovered by accident. Researchers were studying it for its potential as a tanning agent when they stumbled upon its unexpected side effect, boosting libido. But unlike PDE5 inhibitors, which focus on blood flow, PT-141 actually works on the central nervous system to increase desire and arousal.
So it's more about the want to than the can do.
Hmm.
That's fascinating. And it's FDA approved for treating hypoactive sexual desire disorder, or HSDD, in premenopausal women, right?
That's correct. It's a game changer for women who are struggling with low desire and haven't had success with other treatment options.
Okay, that's a lot of ground covered already. We've talked about microplastics, stress, testosterone, various medications. It's clear that sexual wellness is complex and multifaceted. What are some key takeaways you want our listeners to remember as they think about their patients?
First and foremost, it's important to take a holistic approach. We need to consider the whole person, not just their symptoms. Their lifestyle, their relationships, their emotional well-being, all of these things play a role in sexual wellness. And secondly, there's no shame in seeking help. If you or your patients are struggling with sexual concerns, there are effective treatments available. Don't suffer in silence. It's so important. Sexual health is health, and it deserves the same attention and care as any other area of medicine.
Speaking of care, let's talk about another powerful tool in our wellness blueprint, oxytocin. We often hear it called the cuddle hormone, but its benefits go way beyond just feeling warm and fuzzy.
Absolutely. While oxytocin is associated with bonding and social connection, it can also play a role in reducing stress and anxiety. And as we've discussed, stress is a major libido killer.
So oxytocin could indirectly boost libido by helping patients feel more relaxed and connected with their partners.
Exactly. And think about those patients who struggle with emotional intimacy. Oxytocin supplementation could be a game changer, helping them feel safer and more open to connecting on a deeper level.
It's like a secret weapon for building intimacy from the inside out. Now, while we've been talking a lot about medication and supplements, we can't forget about the foundational aspects of wellness: diet, exercise, and sleep.
You're absolutely right. Those are the cornerstones of any wellness plan, and they have a profound impact on sexual health.
Let's break it down. Starting with diet, what are some key things to keep in mind?
Well, you want to focus on whole, unprocessed foods that are rich in nutrients. Think fruits, vegetables, lean protein, healthy fats. These provide the building blocks for hormone production and overall vitality.
And what about things to avoid?
Processed foods, sugary drinks, and excessive alcohol consumption can all disrupt hormone balance and sabotage libido. So it's about making those swaps, choosing a piece of fruit over a candy bar, opting for water instead of soda.
Okay, that makes sense. Now let's talk about exercise. We all know what's good for us, but how does it specifically benefit sexual health?
Exercise does so much. It boosts mood, reduces stress, improves circulation, and increases testosterone levels. It's like a natural libido enhancer.
So if a patient is complaining of low desire or erectile difficulties, recommending regular exercise could be a first line of defense.
Absolutely. Even something as simple as a brisk walk a few times a week can make a difference.
And finally, sleep. We've all felt the effects of sleep deprivation, but how does it impact our hormones and sex lives?
Sleep is crucial for hormone regulation. When we don't get enough sleep, it disrupts that delicate balance of hormones, including testosterone and estrogen. And guess what? That can lead to decreased libido, erectile dysfunction, and other sexual concerns.
So it's not just about feeling tired and grumpy. It's about setting the stage for hormonal chaos.
Exactly. And we can't forget about the emotional toll of sleep deprivation. When we're exhausted, we're less patient, more irritable, less likely to feel connected to our partners. Not exactly a recipe for romance.
It's like a domino effect. Poor sleep leads to hormonal imbalances, which leads to relationship issues, which leads to, well, you get the picture.
It's a vicious cycle. So encouraging healthy sleep habits is essential. Recommend a consistent sleep schedule, a relaxing bedtime routine, and a cool, dark, and quiet sleep environment.
Simple but powerful advice. Okay, we've covered a lot of ground. We've explored the impact of microplastics, stress, and lifestyle factors. We've delved into the world of hormone replacement therapy, PDE5 inhibitors, even the fascinating PT-141. What's the common thread that ties all of this together?
It all comes back to personalized care. There's no one-size-fits-all approach to sexual wellness. We need to listen to our patients, understand their individual needs, and create tailored treatment plans that address the root cause of their concerns.
It's about being a detective, putting all the pieces together, and creating a wellness blueprint that's as unique as the individual.
Precisely. And remember, it's an ongoing journey, not a quick fix. We need to partner with our patients, provide ongoing support, and empower them to take control of their sexual health.
Now, let's talk about a topic that can be a bit uncomfortable, but it's absolutely crucial: communication. How can we encourage patients to open up about their sexual concerns.
That's where the art of medicine comes in. We need to create a safe and non-judgmental space for our patients to share their experiences.
So it's not just about asking the right questions. It's about cultivating a sense of trust and understanding.
Exactly. Start by normalizing these conversations. Let your patients know that you're comfortable talking about these issues and that you're there to help. You can even say something like, many people experience changes in their sexual health. It's nothing to be ashamed of.
That makes it feel less like a medical interrogation and more like a supportive conversation.
Right. And be mindful of your body language. Make eye contact, lean in, and show genuine empathy.
And what about those patients who are really struggling to open up? Any tips for making those conversations a bit easier?
You can suggest they prepare notes beforehand, listing their symptoms or concerns. This can help them feel more organized and less overwhelmed during the appointment.
It's like giving them a roadmap for the conversation.
And remember, silence is okay. Sometimes patients just need a moment to gather their thoughts. Don't rush them. Let them speak at their own pace.
It's about creating that space for them to feel heard and understood. Welcome back to our deep dive into sexual wellness. We've laid the groundwork, exploring the science, the treatments, and that societal landscape.
Now, let's get practical. How can you, as entrepreneurial doctors, apply this knowledge to build a thriving practice and achieve those exceptional patient outcomes?
That's what we're here for, turning knowledge into action. So first things first, when a patient comes to you seeking help with sexual wellness, where do you even begin?
It all starts with listening. Remember, each patient is unique with their own story, their own concerns, and their own goals.
So it's not about jumping straight into prescriptions or protocols.
Absolutely not. It's about taking the time to understand the whole person, their medical history, of course, but also their lifestyle, their relationships, their emotional well-being. All these factors contribute to their sexual wellness.
It's like detective work, piecing together all the clues to get that complete picture.
I like that analogy. And as you gather information, remember to ask specific questions about their diet, their exercise habits, sleep patterns, stress levels. These are all crucial pieces of the puzzle.
And don't shy away from the more sensitive topics, right? Like their relationship with their partner, any body image concerns, or past experiences that might be impacting their sexual well-being.
Exactly. These conversations can be delicate, but they're essential for providing truly personalized care.
Okay, let's say a male patient comes in complaining of, low libido and erectile difficulties. What are your first steps?
First and foremost, rule out any underlying medical conditions. Diabetes, thyroid disorders, cardiovascular disease, these can all contribute to sexual dysfunction. A thorough medical history and appropriate lab tests are essential.
So it's not always a simple case of low testosterone.
Not necessarily. While low testosterone can certainly play a role, it's crucial to consider other factors as well.
Like what, for instance?
Medications are a big one. Certain antidepressants, blood pressure medications, even some over-the-counter drugs can have negative side effects on libido and sexual function.
That's a good reminder to always review a patient's medication list. Now, assuming you've ruled out other medical conditions and medication side effects, what's next?
Then, it's time to check hormone levels. A simple blood test can determine if testosterone is truly low.
And if it is, what treatment options are available?
Well, we've discussed several promising therapies. Testosterone replacement therapy, or a TRT, can be very effective in restoring testosterone levels and improving symptoms, but it's not for everyone.
Why is that?
Well, TRT can have potential side effects, and it's not suitable for men who are trying to conceive. It's also crucial to monitor patients closely while on TRT to ensure their safety.
So what are the alternatives for those who aren't good candidates for TRT?
Enclomiphene is a great option for men who want to preserve fertility. It works by stimulating the body's own testosterone production rather than directly replacing it.
And we talked about how it's generally well tolerated, right?
Yes, it tends to have a lower risk of side effects compared to TRT. Another option is PT-141, which works on a different pathway to enhance desire and arousal.
Right, it targets the central nervous system, not just blood flow. And it's FDA approved for treating HSDD in women, which is a huge win for women's sexual health.
Absolutely. Now let's shift gears and talk about female patients who present with low desire and difficulty achieving orgasm. How would you approach those cases?
Well, I know it's important to consider the potential impact of hormonal fluctuations, especially during menopause or postpartum.
You're exactly right. Those hormonal shifts can significantly impact libido and sexual function. But it's also crucial to remember that women's sexual wellness is multifaceted. Societal expectations, body image issues, and past experiences can all play a role.
So it's about creating a safe space for women to open up about those sensitive topics.
Precisely. You might discover that her low desire stems from feeling pressured to perform, feeling uncomfortable in her own skin, or even past trauma.
In those cases, therapy or counseling alongside medical intervention might be the most effective route.
Absolutely. And don't forget about the potential benefits of PT-141 for women with HSDD. It's about providing options that address the root cause of their concerns, not just masking the symptoms.
Now, let's talk about a challenge that many practitioners face: patient compliance. You can create the perfect treatment plan, but if patients aren't following through, you won't see results. How can we improve compliance?
Patient education is key. Explain not just what you're prescribing, but why it matters. Connect it to their goals.
So instead of just handing them a generic diet sheet, explain how specific foods can impact hormone production or boost energy levels for better intimacy.
Exactly. Make it tangible and relevant to their life. And don't underestimate the power of regular check-ins. Are they struggling with any aspects of the treatment? Do they have questions or concerns?
Building that rapport and demonstrating genuine care can make all the difference in motivating patients to stick with the plan. Now, let's talk about marketing and integrative sexual wellness practice. How do you reach those patients who are seeking this kind of care?
It requires a delicate balance. You want to be informative and professional, but also approachable and sensitive to the personal nature of this field.
Right, you don't want to make it sound like you're selling the latest miracle cure.
Exactly. Focus on building a reputation for expertise and compassion. Share educational content online, participate in relevant conferences or events, and consider offering free webinars or workshops on specific topics.
Word-of-mouth referrals can also be incredibly powerful in this field. Satisfied patients will often share their positive experiences with others who are seeking similar care.
And don't underestimate the power of networking. Build relationships with other healthcare providers, therapists, and specialists who can refer patients to your practice.
Now let's move on to a crucial aspect of any successful integrative practice: continuing education. The field of sexual wellness is constantly evolving, so how do you stay up to date on the latest research and treatment options?
Medical conferences and professional organizations are invaluable resources. Attend workshops, listen to lectures, and engage in discussions with colleagues who are at the forefront of this field.
And dedicate time each week to reading relevant journals and research articles. There's always something new to learn.
And don't be afraid to seek out mentorship from experienced practitioners who can offer guidance and support as you navigate this complex and ever-changing field.
As we wrap up this deep dive into sexual wellness, what are the key takeaways you want our listeners to remember?
Remember that successful integrative sexual wellness goes beyond clinical skills and knowledge. It's about embracing a patient-centered approach, prioritizing ongoing education, and building a practice that reflects your values and passions. Become more than just a prescriber of medications. Become a guide, a confidant, and a champion for your patient's sexual well-being.
So what does this all mean for our listeners? It means you have the power to transform lives, not just by treating symptoms, but by empowering your patients to achieve true sexual wellness, helping them live fuller, more connected, more joyful lives.
It's about fostering a deeper understanding of the intricate connections between our environment, our hormones, and our most intimate experiences. And it's not just about Valentine's Day, it's about year-round well-being.
Thank you for joining us on this deep dive into the world of sexual wellness. We encourage you to keep exploring, keep learning, and keep pushing the boundaries of what's possible in this exciting and evolving field. Until next time.